Let's talk about what to realistically expect after eyelid and upper facial surgery. We typically will do the surgery, patients will go home the same day, and you're gonna look banged up to a degree for on average 10, sometimes 14 days, where it's obvious that you had something done if you're at the supermarket, let's say. Your vision is gonna be blurry to a degree where you're not really gonna feel comfortable driving or reading fine print on average for about 4 days. Really the most annoying part about the whole process is that the eyes just feel uncomfortable because the eyes are the most sensitive area on the body, and even a little bit of swelling or bruising can feel like and look like a lot. The good news is there's not a ton of pain usually. It's more of just that annoyingness that there's some itchiness and swelling and bruising. Where it's kind of obvious, bruised and swollen, usually on average is up to about a couple weeks, sometimes a bit longer. And then to look and feel great, it's usually about the 2-month mark. So if you have an important event, a wedding, something like that, we'd like to space it out that much if we can. Now, if I combine some of the regenerative procedures like my Restore fat grafting, then there's a secondary benefit where you start looking even better starting at 6 months to about 18 months. And that's where patients really start kind of glowing later. Now let's talk about the risks of surgery. Let's talk about, with my experience, what are the most common risks, and I'm gonna go in order. Risk number 1, that the swelling and the bruising is more intense or perhaps takes longer than the average person. It's not that uncommon, and so you just kind of have to be ready for that. And we have all sorts of tricks and tools to minimize it, both in our techniques and with what we're doing, but still, you can't avoid that there's gonna be some degree of bruising and swelling. Risk number 2, that you're still gonna have some degree of bags, wrinkles, maybe asymmetry, specifically if there's pre-op asymmetry. These are the kind of things that might still be there afterwards, and we talk about that beforehand because my goals are safety and looking natural, and then I'll try and get the most long-lasting and robust result. But under that umbrella, you may still have some degree of bags and wrinkles. Risk number 3 is that we need to do some secondary procedure, like a touch-up or occasionally that there's some scar tissue that might form on the inside of the eyelid, or maybe there's a little bit of extra skin. Sometimes the fat that we're moving around from here gets a bit hard and we do some injections. That's gonna happen where I need to do some secondary procedure in about 1 in 20 surgeries. And what you're paying for is being with somebody who's done so many of these that I know how to manage it and will get you to the finish line. Sometimes there's just some speed bumps along the road.